Our first Spark presentation comes from WSU Health Sciences Spokane campus. Freda Gandy is the Executive Director of the Martin Luther King Center. Kay Olson is a Teaching Assistant Professor for WSU Nursing. And Kari Lidbeck is the Immunization Community Network Specialist from the Spokane Regional Health District.
Hello, everyone. My name is Freda Gandy. I am the Executive Director of the Martin Luther King Jr. Family Outreach Center, also known as the MLK Center or the MLK Community Center. People of color have been disproportionately impacted by the COVID-19 pandemic, yet still face many barriers to receiving COVID-19 vaccines. Our Vaccine Equity Initiative aims to ensure that communities of color and other vulnerable populations. Our equity initiative works with the populations and communities hardest hit by COVID-19 to increase awareness and acceptance of the vaccine. Some of the goals of the initiative is to increase trust in vaccines safety and efficacy, acknowledging that in many communities of color, mistrust and hesitancy can stem from a history of medical mistreatment. Another goal is to identify and reduce barriers for accessing the vaccine and increase access for people of color by hosting clinics. Clinics are hosted at the MLK Center twice a month in collaboration with WSU and the Spokane Regional Health District. The clinics provide a safe, welcoming, and community-based environment. We also provide culturally specific and trauma-informed vaccine education and outreach to those most impacted by COVID-19. At the clinics hosted by the center, people receive other resources such as a box of food, hand sanitizer, mask, snacks, water, and juice are offered while people wait in the 15-minute observation area. Transportation is also provided for those that need transportation or do not have access to transportation within our community. We also take this opportunity to inform people about other programs and services that are offered by the center as well. We also provide lunch and snacks to volunteers as a token of our appreciation. A few volunteers have expressed interest in volunteering at the center on a regular basis. So we're excited to not only be able to provide access to vaccines, but we also are recruiting volunteers long after we're done hosting clinics as well. As an organization that has been providing culturally responsive educational and social programs in the Spokane community, we're doing what we can to accelerate the rates in which communities of color are receiving the vaccines. But this would not be possible without the collaboration of WSU and the Spokane Regional Health District. And now I will turn it over to Kay Olson with WSU.
There we go. Sorry about that. So thank you, Freda. So again, and she's also, while she's talking, showing some of the demographics of some of the populations that have been served in the community. And we'll have more from that in a little bit. But working as a registered nurse and a faculty member of WSU College of Nursing, I'm able to work with absolutely amazing community partners like the Martin Luther King Community Center and the Spokane Regional Health District. As a community health instructor, I'm well aware of the inequities and the health disparities of many of our community members. So working with both of these agencies, we've been able to bring together many people to help provide vaccinations, serving these people in their very own neighborhood. Our collaboration with the MLK Community Center and Spokane Regional Health District isn't just beneficial to the members of our community, it's also a great learning experience for health science students at WSU. We've had so many opportunities for interprofessional learning between nursing and pharmacy students who've been able to learn and serve the community while they're working side by side. So this gives them a great perspective of each other's profession. We've also been able to work with Gonzaga nursing students and the Medical Reserve Corps members as well. So these efforts would not be possible without Martin Luther King and without the Kari Lidbeck from the Spokane Regional Health District. So I think we're a little bit ahead of our slides here, but I'm going to turn that over to Kari now. Is Kari here yet?
Yes, I'm here. I just was, sorry. As we always are trying to make sure that we have our microphones on. So yeah, good morning. My name is Kari, and I'm really pleased to be able to be part of this presentation today. The mission of our immunization program has always been to provide no-cost vaccination services to our community. We look for ways to remove barriers for those who can't typically access vaccines. And for some, barriers can include the cost of the vaccine, maybe transportation, and as Freda mentioned earlier, just a lack of trust around the vaccine itself. So prior to COVID, our vaccination efforts were focused on childhood vaccines, some adult vaccines, and specific vaccination efforts that targeted outbreaks such as mumps. And a couple of years ago, we had a hepatitis A outbreak. So last summer, when we realized that COVID-19 vaccine was forthcoming, we began planning for how to get shots in arms. And part of that planning included the creation of an equity task force to ensure that vaccines were made accessible to those who are disproportionately impacted by COVID. And this group here at SRHD is led by Helene Dewey, our health equity specialist. Just for those of you who may not have realized, but we haven't actually had a clinic here at the Regional Health District since 2012. So everything that we do related to vaccines is always off-site. Our vaccine clinic models are varied depending upon where the event will be held. And one of the models that we use is called a pack and go. And in that situation, a community partner such as Kay Olson from WSU will come to our facility and pick up all of the supplies, the vaccine, and they take it to the clinic event location, which in this case is the MLK Center. And by the way, I love all the pictures that you're sharing with us today, ladies. So the outcome of these partnerships is that as of February, I believe, 1,300 doses of vaccine have been administered at the MLK Center, and about 40% of the people have been people of color. In addition to MLK, we've also partnered with other groups, such as to vaccinate the Marshallese community, Latinx, those who are living homeless, and other impacted communities. So, you know, without these partnerships, and I know both Freda and Kay have mentioned this, but it's worth repeating that there is a large part of our community that wouldn't be vaccinated if it weren't for these partnerships. So finally, I want to acknowledge my coworkers, Audra Marshall, who helped Kay initially in scheduling these events and coordinating those efforts on our end, and Kayla Myers, who is our team lead, and she does all of our vaccine ordering and make sure that we have what we need to do these clinics. So thank you again.
So, do we have any questions?
Again, feel free to put any questions for our presenters in the chat if you have them, or you can also send them direct messages during some of our other presentations. We're just going to drop the PowerPoint for 1 second while we get a refreshed version up. So bear with us for 1 second.
So we do have a question. It says, what was your biggest challenge when setting up these vaccination sites and opportunities? Probably deciding on a date. That was probably the rest of it was pretty easy. Again, MLK Center and Spokane Regional Health District are both clinical sites of mine. So I've worked with both groups for the last couple of years, and they're just so easy to work with. We've done the pack and go. So really it was just deciding on a date and getting it set up. Obviously the first session was the hardest, just getting our jive going. But now the clinics just run seamlessly. I think we've done 10 clinics so far. We have 12 more scheduled. I don't know. What do you think, Freda? What was the biggest challenge?
Well, for us, I thought my biggest challenge would be just getting people to access the vaccines here at the center. I knew going in that there was a lot of hesitancy, especially in the Black community, around taking vaccines. So I knew my biggest role would be being one of those trusted messengers that would be a huge advocate for vaccine distribution and access, and making sure that people still who put so much trust in us as an organization in the first place would actually come and get vaccinated. And so far, we've been really successful in tapping into the community and doing a lot of outreach and education and letting people know that they can come here and receive their vaccine.
So there was also a question, Freda, how did you convince those that are skeptical of the vaccine to get it?
A lot of conversations. We have on staff a very diverse staff, so we freed up some of the time for staff to be able just to talk to people on the phone, to process the information that that they were hearing either on the internet, and just dismantling a lot of the misinformation that people were hearing, providing true, actual factual information regarding the vaccine has been one of the major tasks that we've been doing, in letting people know that a lot of the information that they're reading on the internet is just simply not true. And helping people walk through that. And I know for the Black community, the older generation has been the biggest challenge for us, just because they are reliving a lot of trauma around mistrust within the healthcare setting altogether. The Tuskegee experiment comes up for them. A lot of different medical issues and mistreatment of people of color over the years come up for them, and they're dealing with that trauma. So our goal here at the center, I have social workers that are helping them process that information that they are reliving, and hopefully they can get past it enough to actually be vaccinated. So having a diverse staff, people of color on staff to talk to people has been a huge help.
So there's also a question about, was cost an actual barrier or a perceived barrier? So again, maybe Freda, if you want to ask or answer the perceived barrier, and then Kari can talk about actual barrier, about the cost.
Cost wasn't a barrier for us. We received a lot of donated items, such as sanitizer wipes, everything that we needed from the clinic. A lot of the equipment and supplies came from the community. The clinics are held during the day, so a lot of the staff that already works here and is familiar with the people in the community are working in the clinics, helping people schedule their second dose. We try to make sure that people do that before they leave. And I think that has been helpful in ensuring that people actually come back for their second dose, is that they are able to schedule it before leaving. And usually the people that are helping schedule the second dose are usually employees of the center.
Right. And so for the people participating, actually getting the vaccination, there was no charge. So the health district does not charge the vaccine, and there was no administration charge at all. So there was absolutely no charge for the people participating.
Yeah. No, we just like to remind people that a patient should never be charged for any portion of the vaccine. There are some groups that are able to charge an administration fee if the person has insurance, but they cannot ever personally bill the patient for that, because everything should be at no cost, regardless of if they go to a pharmacy, a Safeway pharmacy, something like that, or they go to a provider office or a clinic such as ours.
Okay, thank you for those great questions. Thank you to Freda, Kay, and Kari so much. Great presentation.
Thank you.